So for this next section, we are going to look at our skin. And your skin is an organ. It is called the integumentary system. That's the fancy word for it. Um, you might know, just as a fun fact, that our skin is our largest organ of our body. It covers our entire surface, it encapsulates all our internal organs, and it serves as a sensory receptor, helps regulate our temperature, and it does a lot that we do need to appreciate. It is broken into three primary layers. So we have our epidermis, which is the thinnest layer, but this is the durable top layer of our skin. So this helps protect us from abrasions, things from getting in our body. It's composed of dead skin cells that are packed tightly together. And there are some nerves that kind of reach in here, so you kind of see it branch off here in this faint yellow line, and that's detecting like temperature changes in pressure, or even pain in some instances. Then we go into our dermis, which is our thickest layer. This contains blood vessels, our hair follicle. There's a muscle here that helps us make our hair stand up. So if you ever get goosebumps, these tiny little muscles here induce that. I mentioned our hair follicle. We have a sweat gland in here as well that'll secrete to the surface. And that's the big thing with our dermis. It just houses all of these different structures that have the variety of different functions. Then we have our subcutaneous layer, or our fatty layer here. And this helps us thermal regulate to a degree. So everybody has some amount of fat that helps keep the heat inside. If we didn't have this fat, we'd get cold. We'd be very sensitive to changes in temperature. So, damage to this could be detrimental to a lot of functions. If we have damage to the epidermis, maybe in the form of a burn, or the skin is torn off, maybe through an avulsion, that opens the door for bacteria and things from the outside environment to get inside of our body. The epidermis does have bacteria and stuff that hangs out on it all the time, and that's perfectly fine. It's harmless on the surface of our skin. It actually serves us well. But when it gets into these deeper layers, that's when we start dealing with issues with infection. Another thing that our skin does, especially our epidermis, is that it kind of helps us maintain a fluid volume. If we didn't have this epidermis here, we would actually have fluid that seeps out of our skin. If you kind of try and think back, when you get minor scrapes, and it's not bleeding that much, but you kind of see a fluid that's kind of seeping out of it, and if you kind of dab it, it looks yellow. And that is our bodily fluid. So like plasma from our blood vessels and interstitial fluid in between cells that starts to seep out. And when we talk about trauma and burns, we'll talk about the significance of that damage and what some of the complications can be. So the big thing is to remember which layers which. So your epidermis is the most superficial and your dermis is a little bit deeper. Then you have your subcutaneous tissue, and that helps insulation and also serves as an energy reservoir. Our body has multiple ways of storing energy, and fat is one of them. And the three major functions is to protect us from the environment. Again, we don't want a lot of things from the outside getting in. Now, we can utilize the skin to deliver certain medications. We can use transdermal patches that our skin slowly absorbs certain medications. It's common for birth control. It's also common for certain pain medications. And that helps kind of create a slow, controlled mechanism of delivering medications to the body. As I mentioned, it helps us regulate our body temperature, and it transmits information from the environment to the brain. As I mentioned, there are sensory receptors on the surface of our skin that detects these changes in our environment. Yes, it's the biggest organ, and it's important to appreciate these functions because without it, we would be very susceptible to a lot of different things that our body may not be able to handle on their own.